for today, I'm going to test the cranial nerve 12 or the hypoglossal. So the function of it is responsible for our tongue. Before we ask her to open her mouth and move it all around, we're going to look at the tongue because there may be a certain lesion of the hypoglossal nerve. I want to determine if there is a fasciculation and atrophy because there may be more intake of the lower motor lesions. So for the first test, I'm going to ask her to open her mouth and look for its tongue. Then after that, I'm going to look for the atrophy and fasciculations. Okay, good thing I didn't find any, which is beautiful. The next thing we will do is to test her ability to protrude her tongue out. So I'm going to ask her to open her mouth and then move his tongue to the right and then to the left. Okay. It is a good thing that she was able to move her tongue out left and right, and therefore, what I'll be looking for is if she sticks her tongue out and leans to one side, that made me think of a hypoglossal nerve lesion. Therefore, if my thoughts diverted to the left in that case, I might believe that there is a left hypoglossal nerve lesion because her tongue was in the midline of her mouth and she was able to move left and right, making the entire movements. So for the last test, I'm going to ask her to stick her mouth at the corner of her mouth and push it against her cheeks. So on the right cheek first. Okay? Okay? And I'm gonna do the same thing on the left side of her cheeks. Okay. So, it is a normal strength only. So that's how I perform and conclude to test the cranial nerve 12.